Hi, I'm Steve Pemberton with Nuclease Probe Technologies. And on behalf of James McNamara, founder and CEO of NPT, I wanted to thank all of you for the opportunity to share our story about how NPT is speeding up critical laboratory results needed to diagnose patients with sepsis. Sepsis is a leading cause of death and disease worldwide. It results in over 250,000 patient deaths here in the US a year, and it's the leading in-hospital expense. At NPT, we asked ourselves, what could we do about this? And the answer in our minds was really simple. Let's speed up these laboratories, what physicians call phenotypic antibiotic susceptibility testing, and get the right drug to the patient in a timely manner. Speeding up antibiotics delivery to the patient has been shown to make them better faster, gets them out of the hospital, it saves lives, and it reduces hospital costs. These traditional laboratory results take 3 to 5 days currently. The lab takes a blood sample from a patient, they mix it with typical antibiotics designed to treat bacterial infections, and they figure out which one is going to kill it. And then they get that information to the doctor, and he prescribes that. Newer methods that are based upon looking for bacterial DNA or genetic resistant markers are, number one, they're expensive. 2, you have to wait until the blood culture is positive, which takes over a day. They're also prone to false positives and false negatives. At NPT, we've created a new technology called Nuclease Activated Probe Technology, our NuCAP for phenotypic AST. So the traditional gold standard result the physician wants is delivered to them in 7 hours from when the patient walks in the front door of the hospital. How do we do this? It's really simple. Just like the laboratory, we take the blood from the patient, we mix it with our proprietary reagents in a simple, low-cost, and effective manner and incubate it in the presence of antibiotics. And based upon the protein expression levels of the bacteria, we determine if that antibiotic is going to be effective at treating that patient or not. If protein expression levels are high, we know that bacteria is resistant. If protein expression levels are low, we know it's susceptible. We've clinically proven this in a peer-reviewed study versus traditional laboratory methods for the identification of one of the most pathogenic organisms called Staphylococcus aureus. And we've proven that we're 100% sensitive and 97% specific with a negative predictive value of 100%, meaning that the test result's negative, you don't have Staphylococcus aureus. And we've published those results. We're focused on building a test for a panel of organisms that physicians call the escape bacteria. These are the most pathogenic and drug-resistant bacteria that cause over 85% of the bloodstream infections. Our technology is not limited to detecting just that. It can detect virtually any bacteria and test virtually any antibiotic. The technology has been extensively peer-reviewed in scientific publications like Nature Medicine and others. And we've advanced the technology with over $2.3 million in targeted investment. The successful and exclusive license of the technology accelerated the formation of a business team to identify funding opportunities and initiate product development. We've created a patent estate consisting of a composition of matter and methods with an issued patent and 2 patents pending. We've secured initial investment from Breakout Laboratories in February of this year. Breakout Laboratories, founded by Peter Thiel and Lindy Fishburne, recognized the value of our sepsis diagnostic solution. With that money, we're hiring scientists and research assistants to begin work here in Lowell at M2D2. We're currently raising an additional $1 million to further support the development of our escape panel for complete identification, antibiotic susceptibility testing, and supporting clinical data. With that, we'll continue to advance the company.
Thank you very much. That was a great presentation. One question, 2 related questions actually. One is are they going to have to replace their equipment in the lab? Is this going to replace something in there? And what is the reaction of the lab managers to changing their current processes to bring this in?
It's all about attaining that information as quickly as possible. Laboratories are very open and receptive to adopting technologies that deliver value, right? And the critical value that they want is to deliver that antibiotic susceptibility testing as quickly as possible to that physician. To answer your first question, the technology can run on any simple liquid handling robot that's commonly available in laboratories. However, for widespread commercial adoption, we do visualize a small benchtop point-of-care instrument as being the primary vehicle to really capitalize upon this market potential.
Great, excellent, thank you.